Multiple sclerosis literally means multiple scars. This is about the diagnosis and onset. Doctors don't know the exact cause of MS. It could be different for each MS patient. There's evidence to suggest that if you live close to the equator when you are a child, you are less likely to get MS. If you live in a northern region further from the equator, you are at a probable high risk to get MS. If you live in Northern Europe or are of Northern European descent, you are at a high risk for MS. If you live in a region closer to the equator, you are at a low risk for MS. Doctors think smoking could cause MS. There is evidence to suggest that very clean childhood surroundings or not going to daycare can be a factor for MS because you are not exposed to lots of germs. If you aren't exposed to lots of germs, your immune system may not be strong enough to battle off some diseases and infections that are linked to MS. To diagnose MS, doctors can use something called the hot bath test. A patient will climb in a tub of hot water. If their symptoms worsen, they probably have MS because MS symptoms worsen with heat. An MRI may be used to create a picture of the brain and spinal cord. In severe MS, there is a visible loss of tissue and increase in fluid in your brain. A lumbar puncture is another way to diagnose MS. Doctors will extract a little bit of cerebrospinal fluid, which surrounds your brain and spinal cord, from the vertebrae. If there are high levels of inflammatory cells in the fluid, a patient has MS.
Made with Doodlecast Pro.